Okay, let's unpack this. If there's one journey that's just defined by, well, constant immense emotional weight, it's dealing with fertility challenges. We know that pressure is just relentless. And managing that mental burden, it's often this sort of unacknowledged key, really, to just sustaining the whole process. So today we're diving into a pretty fascinating development. It's this synthesis, you could say, of decades of really specialized care with some cutting-edge neurotechnology.
Yeah.
We're looking specifically at how the neurovisor technology is being used within the framework of the Berkeley Center for Reproductive Wellness.
Yes. And our mission really is to distill the core facts about this combination for you. We're talking about taking highly focused, specialized knowledge and integrating a tool that's designed very explicitly for stress reduction. This isn't just like generic wellness advice. It's a focused pathway, a way to address the profound mental and emotional toll that's just inherent in this journey.
Okay, so let's establish the foundation here. We're talking about the Berkeley Center for Reproductive Wellness, and they're now integrating these neurovisor sessions right into their care model. And like you said, this isn't just any spa adding a new piece of equipment, right? This is a highly specialized environment.
That's exactly the crucial context.
Yeah.
The center is led by Mike Berkeley, and his role in the complementary medicine space, well, it's genuinely foundational. What's fascinating here, and the sources point this out, is that Mike Berkeley is identified as the first complementary medicine practitioner in the entire United States
Wow.
to specialize solely, completely, in treating those undergoing fertility challenges.
The first, really.
The first. Think about the history there. I mean, this expertise wasn't just established last year or something. It implies decades of understanding, really getting how stress, emotional well-being, lifestyle factors, how they all interact with reproductive
The
health.
deep history.
Exactly. And that specialization makes the center uniquely positioned, to evaluate and adopt new technologies. They know exactly what problem they're trying to solve for their patients.
Okay, but wait a second. If Mike Berkeley already specializes in complementary medicine, and that often includes established techniques, right? Like specialized acupuncture, maybe counseling, things for stress reduction. So how does bringing in a tech tool like the neurovisor offer something fundamentally different? Does it replace that expertise or just add to it?
That's an excellent question. It's really an enhancement. Think of it this way. The deep history, that complementary care experience provides the whole framework,
Okay.
but the technology offers a novel way, a different angle, to address brain-based stress. The sources we looked at note that this combination is seen as an excellent approach, precisely because it takes this sometimes abstract idea of emotional support and applies a very targeted physiological intervention directly to the nervous system. So you're addressing that chronic cumulative stress, the kind that traditional methods might take, a bit longer to really mitigate.
That makes sense. So it's not replacing, it's adding another layer.
Exactly.
Leveraging those decades of clinical understanding with a tool that offers maybe faster or more specific support right where patients really need it.
Yeah.
Targeting that constant feeling of anxiety, the pressure that comes from, repeated treatments, diagnosis cycles, all of it.
Precisely.
Okay, so let's move to the tool itself then. Speaking of that expertise, let's talk about the specific technology they chose to bring in. What is the neurovisor primarily used for at the Berkeley Center? What's its job there?
Yeah, the sources are very clear on its targeted utility in this specific setting. Its primary function really is to help reduce stress and anxiety. Full stop. No, we don't need to get into the patent level deep dive on the mechanics.
Right.
But the goal is defined by the outcome. Reducing those physiological markers of stress, the kind that just pile up when you're facing these high-stakes medical situations month after month sometimes. Just adopting this device, it indicates a really strategic decision on their part to tackle those heightened anxiety levels that are so common in the fertility population.
Okay. And for anyone listening who does want to dive deeper into the science, the hardware, the mechanics of the device itself, separate from this specific application, you can find all the necessary details directly from the source. The official NeuroVisivor website is accessible at https://neurovisr.com. We'll make sure that's clear.
Exactly. Our focus here is the application, not necessarily the engineering behind it. And, if we connect this specific application back to the bigger picture, back to Mike Berkeley's specialization, we start to see why this tool is so vital in their approach. They aren't just offering some general mental wellness session. They are targeting specific, often debilitating mental health challenges. The center explicitly uses the neurovisor to help manage three key factors that commonly plague this patient population: depression, anxiety, and insomnia.
Okay.
And these are not just, unpleasant side effects. They can be major hurdles in the actual treatment journey itself.
That list, depression, anxiety, insomnia, that seems really critical. Why focus on that particular triad, specifically in the context of reproductive health? What's the connection between, say, chronic sleep deprivation or profound stress and the actual goals of fertility treatment?
Well, if we look at the systemic effects,
Yeah.
think about it. Chronic anxiety, depression, they triggered this constant state of elevated stress hormones like cortisol.
Right. The fight or flight kind of thing.
Exactly. And this prolonged state, it doesn't just make the patient feel miserable, which is bad enough. It demands immense mental stamina just to get through the day, let alone complex medical protocols. And then when you introduce insomnia into that cycle, the body loses its fundamental ability to repair, to regulate itself overnight. Sleep is crucial. So when a patient is severely anxious, maybe depressed, and chronically sleepless, their ability to just adhere to complex medical schedules, to manage the inevitable emotional setbacks, even to maintain clear communication with their clinical team, it just plummets.
It all starts to break down.
It really can. So addressing depression, anxiety, and insomnia isn't just nice to have. It becomes a foundational aspect of ensuring the patient actually has the psychological reserves needed for what is often a very long, very demanding medical process. It helps ensure the whole system is regulated, basically.
It's interesting, isn't it? When we think of fertility treatments, we often focus purely on the physical, the hormonal. But this really reminds us how much of a patient's success, or at least their ability to endure the process, relies on their mental stamina. This kind of integrated approach seems to elevate mental health from just a supportive afterthought to a core component of the actual care delivery. It sort of validates the patient's experience that the stress is a huge part of the problem.
Precisely. And this is where that specialized context of the Berkeley Center really comes back into play. They aren't just treating the diagnosis on paper.
Right.
They are treating the whole patient who is undergoing that diagnosis, living through it. And that holistic view, that's really the hallmark of effective complementary medicine integration. They're using the neurovisor to actively try and mitigate that psychological noise, you could call it, that can disrupt the overall systemic balance needed for treatment.
Okay. So for those of you listening who might want to explore this specific service model further, the Berkeley Center provides detailed information right on their website. You can visit www.berkeleycenter.com. That's BERKLEY center.com. Once you're there, you'll find info regarding this specific application under the services section. You'll want to look particularly for the tab focusing on depression, anxiety, insomnia.
Yeah, and it's important to note the intentionality of that navigation, the very fact that they specifically organize their services around these recognized psychological challenges. It shows they really understand the central role these issues play for their specific clientele. It's not buried somewhere under a generic wellness tab,
Good point. It signals they get it. Okay, so that brings us to the final practical details, the logistics. For anyone considering following up on this specialized care option, if you happen to be in the region, where exactly is the center located? The Berkeley Center for Reproductive Wellness is located in Midtown East, New York City. And if you need to contact them directly, maybe to inquire about their services, including these neurovisor sessions, you can call them at 212-685-0985. Again, that's 212-685-0985.
Those logistics are vital, yeah. People need to know how to connect, but maybe let's just bring it back to the core concept before we wrap up. What we've really unpacked here today is the synergy, right, between deep, specialized expertise and innovative technology. Like you said, this isn't just a clinic buying a new device off the shelf. No.
It's an integrated model, and it's clearly built on decades of that foundational specialization.
Absolutely. I think the core takeaway really is that intentional synthesis. You've got Mike Berkeley's long experience being the first complementary medicine practitioner focused specifically on fertility. That provides the deep understanding of the patient's holistic needs, the whole picture.
Yeah.
And then the neurovisor offers this targeted, cutting-edge tool to manage that intense psychological burden that comes with it all. It's a proactive model. It's integrated. And it seems to treat mental wellness not just as support, but as a physiological necessity for the journey.
And, this raises a really important question, I think, for you, the listener, to consider moving forward. How often, maybe in your own complex life challenges, whatever they may be, how often do you perhaps overlook the critical importance of actively treating anxiety and stress as primary hurdles? Instead of just seeing them as unfortunate side effects, you just have to push through.
That's a powerful thought. Because specialized centers like the Berkeley Center, they seem to be moving the dedicated management of mental wellness right to the absolute forefront of high-stakes care. So we'd encourage you to maybe explore further. Think about how complementary medicine, especially when it's informed by true deep specialization, how that dictates the strategic adoption of new technological solutions, like neurovisor in this case, all with the goal to fundamentally improve not just patient outcomes, but their quality of life during incredibly tough times. The device itself matters, sure, but maybe the expertise guiding its application matters even more.